Hello everyone. So our topic for today will be about basic life support. So for the table of contents, we have the basic life support and the cardiopulmonary resuscitation, scope, definitions, and policy. Basic life support and cardiopulmonary resuscitation in the dental practice. So, as leaders of the dental team, dentists must ensure that they and their dental team are appropriately educated, well trained, and certified in performing the BLS with CPR in accordance with relevant national guidelines. It is recognized as the best practice to have the appropriate training and equipment in place to allow the dental team to respond to all medical emergencies or ME quickly and appropriately in their clinic. So, under scope, sudden cardiac arrest or CA is one of the leading causes of death in most countries. So, first, CA can occur everywhere, including in the dental clinic, due to the possible poor outcomes while treating a CA. Time is of the essence. Treatment requires a coordinated effort on the part of the dental team to effectively activate the chain of survival. Second, CPR training prepares dentists and other members of the dental team to provide rapid response to an unresponsive patient. When a person receives high quality of CPR, the blood continues to flow through the heart and keeps the body oxygenated. For the definitions, basic life support or BLS is a type of care that first responders, healthcare providers, and public safety professionals provide to anyone experiencing cardiac arrest, respiratory distress, or an obstructed airway. It requires knowledge and skills in cardiopulmonary resuscitation or CPR, using an automated external defibrillator AED, and relieving airway obstructions in patients of any age. Cardiopulmonary resuscitation or CPR, for its definition, it is life-saving procedure utilizing chest compressions and rescue breathing. The latest guidelines put more emphasis on the chest compressions. It aims to keep blood and oxygen flowing through the body when a person's heart and breathing have stopped. So, in doing or giving CPR, first is to check the scene for safety, form an initial impression, and use personal protective equipment or PPE. Second, if the person appears unresponsive, check for responsiveness, breathing, life threatening bleeding, or other life threatening conditions using shout, tap, shout. Third, if the person does not respond and is not breathing or only gasping, call 911 and get equipment or tell someone to do so. Fourth, place the person on their back on a firm, flat surface. Fifth, give 30 chest compressions. And in order to do so, for the hand position, two hands centered on the chest, and for the body position, shoulders directly over hands and elbows locked. So for the depth, it should be at least 2 inches. For the rate, it should be 100 to 120 per minute. Then allow chest to return to normal position after each compression. 6. Give 2 breaths. So first is to open the airway to a past neutral position using the head tilt or chin lift technique, and to ensure each breath lasts about 1 second and makes the chest rise. Allow air to exit before giving the next breath. Note, if the first breath does not cause the chest to rise, retilt head and ensure a proper seal before giving the second breath, and if the second breath does not make the chest rise, an object may be blocking the airway. So lastly, continue giving sets for 30 chest compressions and 2 breaths. Use an AED as soon as one is available. So under policy, first is preparing the dental clinic personnel to respond to an ME. Second, steps to activate the chain of survival. In preparing the dental clinic personnel to respond to an ME, first is to take complete medical history for each patient and update it regularly. Designate at-risk patients. Manage anxiety and fear and also pain. If the dental practice has an AED, the whole dental team should have immediate access to it. Dental clinics should be encouraged to have an AED available. Practice CPR and responses to MEs. Training sessions should be performed in both dental operatory and waiting area. The whole team needs to be trained and updated in CPR and ME management. The dental teams that are confident with their BLS or CPR or ME skills will be less likely to hesitate in an emergency. Steps to activate the chain of survival includes survey the scene. It is to make sure that the surroundings are safe to help the person in need. Next is early recognition. This is to check for responsiveness and breathing while ensuring all infectious disease precautions are in place. Next is activation of emergency medical services or EMS personnel. If the person is not breathing or there is insufficient breathing or agonal respiration, initiate CPR with 100 to 120 quality chest compressions per minute. Check heart rhythm with an AED if available. The AED may instruct you to deliver an electric shock to the victim's heart before continuing chest compressions. Next is to continue CPR in an adult as CAB or chest compressions, airway, and breathing. 32 to give 30 chest compressions followed by 2 rescue breaths. Then in children and infants, new guidelines stress airway management aiming for a rate of 20 to 30 breaths per minute while receiving CPR with advanced airway in place or rescue breathing. Next is post-resuscitation care. That's all. Thank you.